Welcome to Prince George's County Town Hall meeting on monkeypox, also known as MPX. My name is Ravinia Hayes-Cozier, and I will be your moderator for this evening. So tonight, I have the pleasure of introducing not one or two, but three distinguished panelists. Our own Dr. Ernest Carter, Health Officer for Prince George's County, and for the state, Dr. David Crum, who's the State Public Health Veterinarian, Chief for the Center of Zoonotic and Vector-Borne Disease, and Peter DiMartino, PhD, who's the Director for Infectious Disease Prevention and Health Services. This town hall will be the first of several more to come. So if you don't get all of your questions answered tonight, there will be another opportunity to do so. Our town hall tonight will inform, educate, and help us better understand MPX. You, the audience, will also have an opportunity to ask questions and get the answers that you've been looking for. So let's get started. Dr. Crum, we're here tonight to learn, what is MPX?
Excellent. Well, Ravinia, thank you very much for having me here. And I'd be happy to provide a little bit of background or help you guys understand, what is MPX? What is monkeypox? How has this come into the news recently? And where do we go from here? And, MPX, or monkeypox virus, is actually a rare infection. And this virus is in the same family or same group as the smallpox virus or the cowpox virus. It is not related to chickenpox. That's a common misconception and just really want to get out. And up until this part where we've had this outbreak recently, most human cases have been reported in Central or Western African countries. And we really don't know, unfortunately, the natural reservoir host for MPX virus. We think it has to do with African rodent species, but there still is a lot of work to be done to really figure out how this virus persists or stays in nature and what that natural cycle is. But recently, from what we've seen with the current outbreak, we know it may have started out as a disease that may have come from animals, but what we're seeing now is more human-to-human transmission. And that's what I wanted to get into a little bit, where we may have had these origins starting from what we call a zoonotic disease, but now it's something that we have to worry about going maybe person to person. And I wanted to provide some information regarding that because there's probably a lot of questions, like how actually is this MPX virus actually spread? And it spreads in a few ways. First and foremost, monkeypox can spread to anyone through close, personal, often skin-to-skin contact. And what that includes is direct contact with monkeypox rashes, scabs, or any fluids really from a person that is diagnosed with monkeypox. It can also occur when you're touching objects or fabrics, that being clothing, bedding, towels, or surfaces that have been used by someone with clinical monkeypox. Now, there is also the potential for contact with what we call respiratory secretions, large respiratory droplets from someone that is infected with monkeypox virus. So you see, there has to be that direct, close, personal, either skin-to-skin contact, or really that touching objects or being very close to someone who is currently infected with that MPX virus. Now, how can direct contact occur? Well, you've probably seen a lot of information regarding, either direct contact during intimate contact, and that includes, any kind of sexual activity, hugging, massage, kissing, and that prolonged face-to-face contact. And we really want to stress that it's not, very just, short-term or casual contact. It's that prolonged face-to-face contact or direct, prolonged skin-to-skin, and in many, many cases, that intimate contact during sexual contact there. Again, still, there is the potential for indirect contact with fabrics or objects or things that may be used during sexual activities, again, including bedding, towels, so on and so forth. So, that kind of really kind of provides at least a foreground or at least a background for people involving, well, where did it come from? Where are we seeing it? And how are we seeing it actually transmitted in this current outbreak? One of the things I also wanted to bring up is there is also the potential for a pregnant person to spread the virus to their fetus. Now, we have not seen that, or to their unborn baby. It is potential to get monkeypox through that. And again, a lot of work is being done to look at that. Again, we have not seen any cases of that yet, but that is something that we have to definitely keep an eye on, because as I said, anyone who's exposed to the virus through that prolonged direct skin-to-skin contact or indirect contact can potentially acquire monkeypox. But again, it requires a specific mode of transmission, and there's definitely a time element in there. Now, as far as animals go, I think in this current outbreak, animals are not playing a significant role. Again, I'm the state public health veterinarian here, and as far as animals or domestic animals, they are not playing a role in transmission, nor have we seen any evidence that they can contract the virus from humans with MPX. So that just kind of provides a little bit of background. I know my counterparts, Dr. DiMartino and Dr. Carter, are going to get in much more detail regarding some of the efforts that are being done here in Maryland, regarding some of the prevention efforts, some of the messaging out there. And then really, I know we're going to summarize more of the symptomatology and get into a little bit more detail about MPX virus itself. But thank you very much, Ravinia. I appreciate the opportunity to provide just a brief kind of background and a little information regarding the transmission to help educate and really dispel any maybe myths that are out there and really make sure that everybody is well informed. So thank you, Ravinia.
I think our audience, in terms of just listening to what you said personal, you had the issue of prolonged contact. Those are the three things that, as we listen, are the takeaways. Yep. So next we're going to have Dr. DiMartino. Now, we've been privy to some information about MPX, but tonight I want you to help us unravel and dispel some of the misinformation that's out there. Sure. This is not an STI, and it's not an LGBTQ disease, but it certainly has had an impact on our community. And with some of our community, they've suffered a disproportionate impact. Mm-hmm. You can tell our audience a little bit about that, and talk a little bit about what the state vaccine strategy is, as well as some of the things that you have in place to deal with some of the harm reduction processes.
Sure. And again, I just want to echo Dr. Crum. Thank you so much for inviting MDH to be a part of this. Events like this are critical to our outbreak response in Maryland. Part of what we really need is our community to understand the symptoms, to seek out testing should they be experiencing symptoms, to engage with our contact tracers, to seek out vaccine if they're eligible for it. But one of the biggest pieces of any outbreak response really is that community engagement. And so events like tonight are critical to get our messaging out into the communities most impacted. As Dr. Crum mentioned, monkeypox, MPX, is transmitted through that prolonged, intimate, skin-to-skin contact. And that's what we're really looking for. That's what we really want to be aware of. It entered into social and sexual networks. And what we have seen in this outbreak is that close, intimate, prolonged skin-to-skin contact is being reported by men with other men. And so it has been impacting the gay, bisexual, same-gender loving, and other men who have sex with men more than any other Marylander. And in general, most Marylanders are at very low risk of acquiring monkeypox, MPX. But in the sexual and social networks that include GBMSM, gay, bisexual, and other men who have sex with men, there is the presence of MPX, and we need people to be aware of it because it can transmit sexually. We have seen a lot of identified cases who have reported that it is transmitted sexually. but we've also seen that skin-to-skin contact. And so we're talking a lot with community about building harm reduction messages, messages that really speak to communities, that identify the specific behaviors in those communities where there's skin-to-skin contact. I know as a identifying gay man, monkeypox is not keeping me off the dance floor, but it is making me rethink some of my outfits, because I do want to avoid that prolonged skin-to-skin contact. And so I think that's really such an important part of our messaging, is understanding who our communities are, what their risk behaviors might be, and how do we help them continue to live their lives fully and engage in the activities that are meaningful for them, but provide them the important information that can help keep them and their loved ones safe. And so I think you're going to hear us say it over and over again. It's really that skin-to-skin contact that we're concerned about. And I know I like to point out that even in the testing, when they test the lesions to get the sample, they have to use vigorous activity to get an appropriate sample. So casual contact in the LGBT community, in other communities, in places of worship, just in general daily activities, the risk of contracting MPX is really low. But for those opportunities where there is that skin-to-skin contact, we really want people to be aware of what their risks are and to take the appropriate actions to protect themselves.
So Peter, what I also heard you say in your harm reduction message was, we really need the community to join with us to get the message out about what and how this disease is transmitted, and to help us learn and educate people in various communities that might be at risk.
Absolutely.
So we're going to move to our third and final speaker. From Prince George's County, our own health officer, Dr. Carter, who provide the information that most of us are curious about. Dr. Carter, can you please talk to our audience about symptoms and testing and vaccinations? And what we get a lot of is who are eligible for these vaccinations.
Thank you, Ravinia. I really appreciate it. And I really appreciate Dr. DiMartino and Dr. Crum for providing their expertise tonight to the residents. It really is important for them to hear this these experts tell them about this disease. And I just like to say good evening to everybody and thank you all for joining us. I want to quickly go over, and this is going to be repeating what monkeypox is, how it spreads, and what the symptoms are. But in particular, I want to talk about testing, treatment, and vaccination. So let me start here. What is monkeypox? And it's just been explained so eloquently. First, I just want to start by saying I'm encouraging everybody to head to our dedicated website for monkeypox. It's health.mypgc.us/monkeypox. Let me repeat that. health.mypgc.us/monkeypox. There you'll find the latest updates and guidance on this virus, as well as vaccination appointments and CDC resources. Now, as it's been stated, the general public is at very low risk for getting monkeypox. Monkeypox can make you sick, but most infected people, unless they have complications, experience mild to moderate symptoms and do not require hospitalization. Now let's talk about how monkeypox spreads, because it's been talked about, and we'll say it again. Monkeypox can spread to anyone through close contact or skin-to-skin contact that has been talked about. That happens through direct contact with monkeypox rash, sores, or scabs. Transmission can also occur if you touch objects, fabrics, clothing, bedding, towels, and surfaces that have been used by someone with monkeypox. You can also get monkeypox through saliva from a person with monkeypox. that this contact can happen during sexual contact as it's been described. It includes oral, anal, vaginal sex, or touching the genitalia or anus of a person with monkeypox. Transmission may also happen during prolonged hugging, massaging, kissing, and talking closely. Now, what are the symptoms? Monkeypox symptoms usually start within 2 to 3 weeks of exposure to the virus. The first symptoms you'll feel feels like the flu. You have fever, headache, muscle aches, backache. You can have swollen lymph nodes, chills. You can be extremely exhausted. Then within 3 days of that, you will start to begin having this rash, these sores that can spread anywhere in the body, really. These sores look like pimples or blisters that may be painful or itchy. The sores may be inside your body or like in your mouth or your vagina or on your anus, or it can be just anywhere on your skin. The sores usually go through several stages of crusting and falling off over about a 2 to 4 week period. And during that time, when you start with the symptoms to the end of the time when these crust over is when you're really infectious. The health department highly encourages residents to speak to their doctor if you're showing or feeling symptoms, or if you have questions, or if you think that you've been exposed to someone with monkeypox. Now, if you have an unexplained rash that looks like a pimple or a sore, this is what you want to do. Avoid sex or being intimate with anyone until you've been checked out. And you want to avoid events or parties that involve close skin-to-skin contact. Most importantly, you must call your doctor and ask about getting tested. If you do not have a doctor, contact a medical provider to ask about testing. That includes the emergency room nearest you. The health department is not able right now to test everybody because we have testing on a limited basis. We don't have resources, capacity, or space to test people on a large scale basis. However, we are working with the state to possibly develop a larger testing operation. At the same time, healthcare providers in our community have the ability to test for monkeypox, and we need for them to help us with evaluating and testing more patients to help in this response. So if you're positive, you must isolate until the rash is fully resolved, the scabs have fallen off, and a fresh layer of skin is formed. This usually takes about 2 to 4 weeks. Now, how can you prevent monkeypox? Well, you have to avoid close skin-to-skin contact. I know we're repeating this, but this is really important for you to know. You got to avoid the skin-to-skin contact with people who've been diagnosed with monkeypox or has a rash that looks like monkeypox. Do not touch the rash or scabs of a person with monkeypox. Do not kiss, hug, cuddle, or have sex with someone who has monkeypox. Avoid contact with objects and materials that a person with monkeypox has used. Do not share eating utensils or cups with a person with monkeypox. Do not handle or touch the bedding, towels, or clothing of a person with monkeypox. And just for general public health reasons where we are now, wash your hands often with soap and water. Use alcohol-based hand sanitizers if you don't have soap and water, especially before you eat or you touch your face or after you use the bathroom. That's very important. Now, the treatments. There are no treatments specifically for monkeypox infections, and the health department does not have the resources or the capacity to offer treatment and the required patient management activities that come along with treating patients. Monkeypox and smallpox viruses are genetically similar, which means that the antiviral drugs and vaccines developed to protect against smallpox may be used to prevent monkeypox. So we do use that. We're working with the Maryland Department of Health and the CDC and our neighboring counties to coordinate our efforts to minimize the spread of the virus. Now, finally, I want to talk about vaccinations. The Maryland Department of Health is in charge of providing local health departments with vaccine. Right now, the county health department has a very limited supply, and therefore we have limited availability for appointments. Please check the appointment schedule on a regular basis on our monkeypox website. That's health, I'm repeating it, .mypgc.us/monkeypox. The vaccine is only available to the following high-risk individuals. Number one, patients who have been identified as close contacts to a laboratory-confirmed monkeypox case through contact tracing investigations. Number two, presumed contacts who meet the following criteria. Those who know that a sexual partner in the last 14 days was diagnosed with monkeypox, or those who have multiple sexual partners in the last 14 days in a jurisdiction with known monkeypox. Now, we will not vaccinate anyone if they have monkeypox or if they're experiencing monkeypox symptoms. If you have symptoms, contact a medical provider for evaluation, testing, and treatment options. Once we get more vaccines, more groups will be eligible. So with that, I'll stop and I'll look forward to the questions. Thank you very much.
Thank you, Dr. Carter. It sounds like you added one more partnership to this whole piece of the puzzle, the community health departments and our providers. So thank you for that. I want to thank the panel for this great overview. But now it's time for us to turn back to the audience and answer the questions that I think that all of you have answered so eloquently, but there are very specific questions that I see people have put into the chat that they want answered. So we'll start that process now. I'm going to ask the panel that when you answer the question to really click on your button that says live. So one of our first questions is, how can you protect yourself when you travel, which includes hotel stays, with spraying, disinfections such as Lysol and other things on your bedding, carpets, remotes, etc. Dr. Carter, can you take that for us?
Yes, I'll be glad to. I recommend this when you go to a hotel and when you travel, period. First, wear a mask when you travel, especially when you're going, on an airplane or in an enclosed space. When you go to a hotel, and of course, keep your hands clean and try not to touch too many surfaces. That's just in general good public health. But lastly, when you go to a hotel room, I recommend wiping everything down. Even though most hotels are very good at cleaning their bedding, et cetera. And so I'm not advocating that you have to go and wash the sheets, but you really should wipe everything down. I'm just telling you what I typically do. I spray the room with Lysol. I make sure everything is wiped down before I put my clothes in there and before I use the facilities. And I just recommend that for just general public health, to prepare you to protect or public health protection.
And Dr. Crump, one of the questions we have here, there's something all three of you mentioned, the word prolonged. And so one of our audience is wondering, what is considered prolonged?
Yeah, again, Ravinia, a great question. When you use a word like prolonged without a specific, quantity, what are we dealing with? And the Centers for Disease Control and Prevention, also known as CDC, have come up with exposure characteristics, or basically certain, sets of times and things. And what they've kind of designated as prolonged, and what we use for risk kind of assessment, is within 6 feet of someone with MPX for greater than 3 hours. So that's usually when kind of considered prolonged. Now, in the context of skin-to-skin contact, we don't necessarily have a time. I think that prolonged contact or being around someone, face to face, has to do with that respiratory, component, or maybe those large respiratory droplets. But if there is direct skin to skin or vigorous contact, meaning that there's rubbing or there's basically potential for infectious material to be transferred from that infected individual to another, again, the time frame or prolonged a lot of time doesn't matter as much it's compared to the skin to skin, like in sexual contact and things like that. But I think in general, it's the 6 feet, 3 hours or more is generally what we kind of go with regarding some of the characteristics there. But again, we don't know a tremendous amount about MPX. We are learning, this is something that we are expanding our knowledge base on. But again, it's something that's the criteria we have for now. Hopefully that provides some clarity for you.
Okay. So with any vaccine, whether it's old or new or resurfacing, one of our audience members would like to know if there are any side effects. Dr. Carty, would you like to answer that?
They're the usual side effects that you get with a vaccine. If you're allergic to if you're allergic to the vaccine, you could have, and you have to be very aware if you're allergic to vaccines. You should talk to your doctor about it. But there are no known significant side effects to the vaccine that is currently reported. So this is a very safe vaccine, and we feel very comfortable with the safety of it.
And Peter, can you tell us how long does it take on an average, for someone who is even in the population that we would like to be vaccinated, how long does it take for them to get an appointment?
How long does it take for them to get an appointment for a vaccine?
Correct.
Yeah, so each local jurisdiction in Maryland has access to vaccine, and they are managing that locally. We have 4 jurisdictions, Prince George's County being one of them, that we are piloting our extended post-exposure prophylaxis clinics at. And so MDH has provided those 4 jurisdictions, and the others are Montgomery and Baltimore counties and Baltimore City. And in those jurisdictions, there's more vaccine available for individuals who may have had exposure in the past 14 days. And so it's really important that when we talk about the extended post-exposure prophylaxis, that we really are talking about risk that has happened in the very recent past. So we are really trying to get those individuals who may not have been as aware about the risks of MPX and had behavior where there was that direct, vigorous skin-to-skin contact. We do want to try and get them vaccinated, because getting that vaccine, should they be infected with MPX, it could reduce the severity of disease, but it could also outright interrupt that transmission. So we're working with the 4 jurisdictions I mentioned to make sure that there is vaccine available, but each jurisdiction has its own method of getting folks in to be vaccinated. I do, since we're talking about vaccine, want to be very clear that we are in an outbreak response right now. And so we are trying to contain this outbreak. We want to interrupt as many transmissions as possible, which is why we're looking at the past 14 days for candidates for vaccination and not thinking about what they intend to do or behaviors that generally might put them at risk. That's what we call pre-exposure prophylaxis. Unfortunately, we are not at a place in Maryland where there's enough vaccine to give people pre-exposure vaccination. But for those individuals, again, coming back to the community, working with our providers, working with our community-based organizations, really getting that messaging out that if you are part of a community that is being impacted, if you are planning behaviors that could put you at risk, vaccine is not the best choice for you right now because we don't have that supply, because we're trying to stop an outbreak of past exposures. So that's where we want to get into that harm reduction messaging and really provide people with other services, with risk reduction activities and options as opposed to vaccine.
Okay. Peter, stay with me a little bit because we have one person who is wondering how soon does the vaccination, once they're vaccinated, how soon are you protected?
That's a brilliant follow-up, because I think many of us are thinking, oh, I got my vaccine, I'm gonna go about my business. And the reality of it is it's 2 doses and full efficacy. So the vaccine works its very best 2 weeks after your second dose. So if you get your first dose, there's some protection, but then you want to come back about 28 days later for that second dose, and then it's still another 2 weeks. So even for those individuals that are getting vaccine based on their most recent behavior, they're still going to want to get those harm reduction messages about activities that could continue to put them at risk, because the best protection doesn't come until 6 weeks after your first dose of vaccine.
That's really important to know. Let's keep that in mind. 6 weeks after, not immediately, but 6 weeks after. I'm going to ask our Q&A folks to respond to some of the 222 people who are wanting their questions, as those questions came from the chat. So I'm going to open up to our Q&A team to begin asking questions. Ania or Delia, can you guys open up?
Sure. There is a question. Why is it mainly impacting gay and bisexual men? Anyone can have prolonged skin-to-skin contact.
Sure.
So Peter, I'm going to give it back to you again.
Sure. So I think many of us in the LGBTIQ plus communities have really thought about this. This in the gay community, this is not our first outbreak. We have lots of experience with this, sadly. Many of us grew up with HIV being this specter on our health. And so I think it has to do with our sexual and social networks. They're smaller, they're closer, they're more intimate, if you will. We are less of the population overall. And so I think when things infiltrate our social and sexual networks, whether that's a virus or a really bad fashion trend, they tend to move quickly and they tend to spread. The other issue that we definitely saw with this particular outbreak, which really came to everyone's attention in Europe at first, was there was a lot of travel. So it sort of hit just around our LGBT Pride events. And so there was a lot of international travel happening. There's a lot of, because we are part of smaller social and sexual networks, we do travel to participate in events, and just in general to be part of the LGBTQ networks that are available. So I think that's part of how it initially entered our networks. I think, we are doing our best to try and get the message out to try and stop that. But we have definitely seen, just in the DMV area, there's a lot of cross-jurisdictional transmission. There's a lot of cases identified in one jurisdiction with contacts from all over the DMV. And that's part of just how we socialize. I really wasn't joking about, I'm not curtailing my time on the dance floor, but I think we do all have to assess our risks about how we approach those activities. And so that's part of the messaging.
One of the questions people are wondering about is, if it's not an STD, then why are we being encouraged to test at public health departments and as an urgent part of care and urgent care? Dr. Carter?
Well, I would like for people to get a test from their providers, any provider that can test them. But why are we testing? Because, so as Peter said, we're trying to arrest the spread of this. We want to nip it in the bud. And so only way we know is we have to test. Once if you have an unknown rash, or if you had those symptoms and you've got a rash, we need to test to make sure that we know that it's monkeypox, and that we do the contact tracing and get people isolated. Because once we do, that is the public health way of stopping a virus from spreading. And that's what we want to do. And that's what we have to do. So testing is important. I mean, you remember with COVID, we had to test, in order to find out, so we could isolate and quarantine. So that's what we have to do with this virus also. We have to be sure that we get testing in, and any provider can do a monkeypox test. It's a straight and very easy test to do. And we need to have as much testing as when people feel that they have an unknown rash and they've had symptoms, they need to get tested so that we can know who you are, make sure you get isolated, make sure we know who you've come in contact with, and then stop the spread of this virus.
Okay. Sona, can you give us a question from our Q&A component?
I can give a question, and it was answered several times within the chat. The question is, can it be transmitted when trying on clothes at the store? Should I wash clothes when purchased?
So, Dr. Crum, can you take a stab at that?
Sure. No, I'd be happy to. And
Thank you.
that's a question that we worry about, is how long does this MPX virus persist in the environment? What are the potential, risks? And, one thing that's working in our favor is these types of viruses are very sensitive to ultraviolet light. They're also very sensitive to certain environmental cues, again, things like that. So they tend to persist in environments that are dark, cool, and low humidity, and they're very susceptible to a lot of common disinfectants. So, again, for as far as casual or every day-to-day activities, as was stressed before by Dr. Carter, really hand washing, good sanitation, basically those basic everyday things that we should be doing, not just for MPX, but for any disease during flu season, during COVID, making sure we're protecting, should be sufficient, again, for those everyday casual type of exposure. So for instance, trying on clothes, so on and so forth, unless there's an obvious stain or some other issue that may cause you to be like, hey, maybe I shouldn't be trying this on. These orthopox viruses, especially MPX virus, tend not to really persist very long in the environment if they're exposed to UV light and so forth, which is going to be in most cases there. Now in cases where it's not, laundry, very effective way to get, to remove or inactivate the virus. We just have to be a little bit careful with specific MP. If we do have an MPX, a monkeypox case, we have to be a little bit careful about how we do the laundry. But those disinfectants and detergents are very effective at inactivating the virus.
Thank you.
Sure.
There's a question here. It's interesting because we know the school is starting back shortly. And for many young people, they're returning back to college. So the question is, should there be any concerns or pauses around students returning back to school, particularly as they're riding on buses or playing sport contacts, those types of things. Dr. Carter, can you help us with that?
Yes. So what I'm recommending is that, first of all, I think we've emphasized a lot that it's skin to skin contact and it's intimate, prolonged skin to skin contact. So the reason we have these town halls is to make people hyper aware of what they should do to avoid getting monkeypox. And that includes our students, because our students sometimes do all sorts of things. So in terms of regular activity, like for instance, sports, it's not a big concern there. However, you still have to be aware that you could be exposed to monkeypox if you're having prolonged skin-to-skin contact with somebody who potentially has monkeypox. So all of the things we reviewed today is what we want our students, our families who have children in school, and to review, understand, and make people aware of, so they can avoid getting monkeypox. And it is a concern of mine. School always is a concern of mine.
Yeah.
My students are always a concern of mine. My college students always is a concern of mine. So that's why we have these town halls. We want people to educate themselves and make sure, and our students educate themselves so they can mitigate their risk.
Thank you. Delia, any other questions from our QA component?
I guess this question, it may have been answered, but this question has gone through the chat several times. With respect to indirect contact, how long does MPX live on surfaces?
So Dr. Crum, can you give us a...
Sure. I mean, I'll be honestly, we're still learning about MPX and how long it persists. There was one study that looked at basically a non-porous surface, like a hard surface, and it was found 15 days after the patient's home was left unoccupied. But again, keep in mind, it all depends on the environment, exposure to ultraviolet light. What is the humidity? What is the potential exposure to either normal cleanings and disinfectants or just environmental factors which may inactivate that virus? So I think as a whole, there is a potential for it to persist, but with this day and age where we're using a lot of hand sanitizer, hand washing, we're cleaning on a much more frequent basis here, which is a good thing. I think, for instance, we're going to be much better protected, and that risk is definitely going to be minimized due to regular cleaning and disinfectants there. So hopefully that provides some clarity for you.
Thank you.
Sure.
Ania, can we get another question from our QA section?
Yes, there is a question that talks about pre-existing health conditions and whether that would make someone more at risk for monkeypox.
Peter, you want to take that one for us?
Sorry, I was answering to myself and realized I was on mute and hadn't been called on. There aren't necessarily more conditions that will put you at more or less risk. Again, it's about that skin to skin. And I saw one of the questions in the chat was, what is it about that skin to skin, or what is it about during sex, that skin to skin? And it's about either all of the openings in our body, those mucosal membranes, all of the places where we're open, but it's also about the skin breaking. So I don't think there's necessarily conditions that can put you more at risk. And one of the doctors can correct me if I'm wrong there. I know people with HIV, it's certainly what we think of, particularly when we're talking about the GBMSM and same gender loving community. There has not been shown that MPX affects people with HIV to any greater or lesser extent than others who have been impacted. And with the vaccine that's available in Maryland, which is Jynneos, it is safe for people with HIV. There is another vaccine that some of us might remember, the smallpox vaccine we're more used to, ACAM 2000, which leaves the scar. That is not part of this outbreak because there are so many considerations. So with the other vaccine, not the one we're using, that might be the one folks are thinking of that has considerations for pregnant women, people with eczema, people living with HIV, people with lupus, anyone who's immunocompromised at all. We would really not use ACAM 2000, and we're not using ACAM 2000 for this outbreak in Maryland.
Thank you. Let's see, I'm gonna go back to Delia. Can you give us another question from our Q&A section?
Yes, I'm sorry, I was on mute as well. We have quite a few questions in the chat that's referencing the not just the shortage or the shortage of vaccines, but also the lack of vaccine appointments. And I believe that those are correlated to one another. So if someone can kind of address that.
Okay, I'm gonna go to Peter first to give a state response, and then I'm gonna go to Dr. Carter to talk about what Prince George's County is doing. So Peter?
Sure. So sadly, I talked about the two different types of vaccine. There is lots of ACAM 2000. The problem with ACAM 2000 is I mentioned there's lots of considerations about that. So the strategic national stockpile at the federal level has lots of ACAM 2000 that was really stockpiled for bioterrorism, a major smallpox outbreak. We're not using that vaccine in this outbreak because it could have a worse impact. So folks can do something called auto-inoculate, move it across their body. They could take it home and transmit it to others. And particularly as we're talking about the LGBTIQ population, we don't want people with HIV to be exposed to ACAM. We don't want people with eczema to be exposed to ACAM. We don't want pregnant people exposed to ACAM. And so we are using the other vaccine, Jynneos, and there is a much more limited supply of that. But in an outbreak response, that is the better choice because more people are eligible for it. And there's much less to consider when giving it to a large population for outbreak control. The problem with that is there's not enough of it available to certainly do that pre-exposure prophylaxis. We are nowhere near that. We can definitely handle all of our named close contacts of known cases, and we are working towards making sure that those folks who have had recent risk can get vaccinated. So that's where our priorities are in the state is we have a very limited supply. There was a very limited supply nationwide. And Maryland got significantly less than even some of our neighboring jurisdictions. And I know everyone's aware, this being Prince George's County, of what's happening in the district. They have a much larger outbreak, and their outbreak peaked or got big very soon. And so when they allocated national resources, DC got a lot more vaccine a lot earlier in the outbreak. So they've been able to use their vaccine a little differently, but they too are focused on post-exposure prophylaxis and extended post-exposure prophylaxis. So we have tried to get our vaccine to the areas and parts of Maryland that are more impacted by MPX in this current outbreak to do that post-exposure and that extended post-exposure. I'll keep saying it. We are not at vaccinating people who might have risk or who have future risk. We are focused on those people who who have already experienced risk. And so that's where we want to break the transmission that's already potentially happened.
Thank you, Peter. Dr. Carter?
Yeah, and I will follow up with what Dr. DiMartino said, is that we're working very closely with the state to be sure that we, distribute the vaccine wisely and according to the, the priorities that have been set and the rules that have been set. Number two, we are working on expanding our capacity to do it. And I know you all know that our health department and all health departments really took a hard hit with COVID. We have to build our public health infrastructure and capacity back up. The state is working very closely with us to help us with that. And we do understand that the reason that the President of the United States declared a national emergency is so that more vaccine could be made rapidly. So we anticipate, as Dr. DiMartino said, getting more vaccine. We realize that the vaccine that appointments are not as easy to come by because of the limited supply, but we're working hard to rectify that.
Thank you. So Nia, I'm going to go back to you. Can you go to our Q&A component and give us the next question?
Yes, this may have been addressed, but there are quite a number of questions about the incubation period and the probability of infecting or spreading the virus before symptoms begin to occur in an individual.
Dr. Crum, since you talked about transmission, can you tell us a little bit about if there's an incubation period and how long that might be?
Sure, I'd be happy to. Now, incubation period, or the time from when an individual is exposed to the pathogen or virus until when they show clinical signs, is what we're kind of talking about here. And for the MPX virus, it's anywhere from 5 to as late as 21 days is basically what we're kind of monitoring for. What has been seen, kind of the more commonly seen one is between 7 to 14 days is where we're kind of looking for the incubation period of MPX. So that's basically what we're monitoring for. And that's what a lot of our isolation guidance and sorry, not isolation, but monitoring guidance after an exposure is that we're going to monitor for someone for 21 days post-exposure to see for those high, low, even intermediate risk contacts, are they going to develop symptoms and go from there? So that's just a little info about infectious period. Incubation period, sorry.
We have about 5 more minutes, so I'm going to ask my Q&A folks to look to see if there are similar questions that we can get answered by the panel, so we can answer as many as possible. So Delia, I'm going to go back to you and ask you if there are questions that are similar in nature, but we can answer now.
Yes, there's several questions that's referring to eczema, and they would just like to have clarification on if I have eczema, shouldn't get the monkeypox vaccine, and does having eczema make me more susceptible?
Dr. Carter, you want to take that one? It sounds like the person wants to know if they have eczema, and should the vaccine be something they should even consider?
Well, first of all, if they have eczema, it doesn't make them any more susceptible than a person who doesn't have eczema. If they come in intimate contact with somebody who has monkeypox, skin-to-skin contact for a prolonged period of time, which we've talked about, they can get monkeypox. But because you have eczema doesn't make you more susceptible. And if you haven't come in contact with a person with monkeypox or been exposed in those situations that we've described, then you don't need a vaccine at this point. And as Dr. DiMartino said, at this point, we're not vaccinating people to prevent them from getting monkeypox if they have not been exposed to the virus, or they have been in a situation where they were at risk of getting exposed. And I think we went over those things. But I want to be clear that if you have eczema, no, it doesn't make you more susceptible to getting monkeypox than a person who doesn't have eczema.
Okay, thank you. So Ania, can you give us another one real quick so we're able to answer some of these questions? Because we have a lot in the Q&A.
Sure. This has been kind of repeated. We've addressed it somewhat, but there are still concerns specifically about whether the virus lives on porous versus non-porous surfaces.
Okay. Dr. Crum, you want to take that one for us?
Sure, I'd be happy to. The question of porous versus non-porous, non-porous being like glass, metal, or hard surfaces where, there's not lots of nooks and crannies or things for them to hide. And then a porous surface being either fabric, towels, linens, rugs, things like that. Again, we're still trying to understand a lot about this virus. And I think there's probably more potential for the virus to persist in environments where, again, they're dark, there's not a lot of exposure to ultraviolet light, that they're dry, there's not a lot of moisture there, and the temperatures, aren't very high. So these non-porous surfaces are potentially a concern, but I think it plays more of a role if in a household or a non-healthcare setting in which we have an individual that's infected with a confirmed case of MPX, where they're living there, there's prolonged or there's a living situation in which there's multiple kind of either days or weeks of potential exposure and accumulation of infectious material. Now, again, in that case, there is still recommendations to clean and disinfect, steam cleaning being one of those. So there are still methods for non-porous surfaces to be disinfected. But I think for casual, everyday activities and so forth, again, the fact that these orthopox viruses are very sensitive to environmental factors, and the fact that we're, in this day and age, we're washing our hands very frequently, there is a lot of, I think, effort or focus on that personal hygiene, not just for MPX, but for for other things that are out in the environment. I think that risk is low, except for in the situations that we've already discussed. So, I think with the clothing and the non-porous and those potential environments in which it may persist, I think that's more of in a context of which, say you live in a household with someone that may have been diagnosed with MPX. And the good news is there's a lot of information on the web from the Centers for Disease Control and Prevention, or CDC, about that. So, the local health department, especially, I'm sure Dr. Carter might be able to elaborate, working with cases that are identified and providing that guidance. So in those specific situations in which there may be a higher risk associated with those environments, the state as well as the local partners are there to help with those cases.
Well, we have a lot of people in the Q&A, and unfortunately, we've come to a point of this particular town hall being over. But remember what I said earlier, there'll be other town halls and other updates where people will be able to visit us again and talk with us again and get those questions that you weren't able to ask tonight, but can do it later on. You can also go to our website, health.mypgc.us/monkeypox, and go on there. We will try to answer those things that we didn't get through in the chat as much as possible. Some of those questions will also be answered on that website as well. So there'll be an opportunity for your question to be answered. Thank you so much for tonight. The interest from our community and what you provided for us, hopefully will give us some insight in what we need to do as residents of Prince George's County, providers, and working closely together with our health departments and the state. Hopefully we'll overcome this. So thank you. Take care. Good night.